ICLs, that's an acronym. In the scientific parlance, that refers to implantable Collamer lens because it's made of a material called Collamer. But conceptually, you can think of it as an implantable contact lens. And this is sort of an alternative to LASIK or PRK. And we have a lot of success with LASIK and PRK, and we do the most advanced form of LASIK and PRK using a true wavefront ablation and a laser to create the flap. But for patients who may not be a candidate for LASIK, or even sometimes their correction is too great or too high of a correction for LASIK, ICLs for many patients are a great option. And it's a lesser known option, but it's very important. And it's actually gaining traction across North America in terms of doctors' recommendations. Why do we have ICLs? Well, for the first reason is that when a person is being considered for LASIK, corneal thickness is one of the parameters that we look at to make sure they're going to be safe as a LASIK candidate. And for some people, they may be disqualified because their corneas are too thin, or the relationship of the corneal thickness to the level of correction. And other factors like that may eliminate LASIK as a potential modality for that patient. ICLs do not require any certain corneal thickness, and it is a permanent implant that is placed inside the eye, behind the iris, and in front of your natural lens, which is called the crystalline lens. There are some advantages to this. While it is a slightly more invasive procedure, meaning we perform it intraocular and it's in an OR setting rather than just in a LASIK suite, there are some optical advantages, and by placing the correction closer to what's called the nodal point of the eye, we see very significant optical advantages. In many patients, we see a gain of 1 or 2 lines of vision on the eye chart. In other words, as opposed to their previous best corrected. Other conditions which would make LASIK problematic are dry eye and high levels of astigmatism. Now, we can correct a lot of astigmatism with LASIK, but not every patient is a candidate for LASIK or PRK, which is the surface ablation version of LASIK. And so for patients who just aren't candidates for laser vision correction, ICL does have the ability to correct both high levels of nearsightedness as well as astigmatism. As your eye matures and you have the ICL in place, generally it is not a plan that we would take it out and change it at any time. The typical lifespan of an ICL is we would place this in someone in their 20s or 30s, and it is going to stay there until they are in their 60s or 70s and they develop cataracts, at which point both the ICL and the cataract would be removed and replaced with a permanent intraocular lens implant. ICL, the recovery time is amazing. It's so quick. We actually see these patients here in the clinic about an hour after their procedure, and at that point, most of those people are seeing 20/20 or close to it. So the wow factor for ICLs is very high, probably even greater than with LASIK. Generally, ICLs are for younger adults, and this will accomplish vision correction, which is really unparalleled in terms of the optics. By placing that correction inside the eye, we see not just an equal vision to what we could achieve through contacts and glasses. In many cases, these people will see better than they were able to before surgery, even with their correction.